everybody, welcome back to MedPod. At MedPod, we are committed to give health-related awareness to you guys in the very simple way possible. Today, before we get into the main topic, I want you to go through a quick story. It is about a case I recently saw in my department. The 42-year-old woman who works as a school teacher, she came to me with complaints of pain in the bottom of the foot, especially the heel area. She also added that the first few steps out of the bed was unbearable. It's like walking onto needles. As the day went on, she got a little better. But she also told that if she sat down for a long time and then stood up again, the pain returns. She had a history of borderline diabetes mellitus. Other than that, there was no other comorbidities. There was no history of trauma, infection, or doing any sort of like heavy weightlifting or heavy workout. Because of her borderline diabetes mellitus, the doctor had advised her to start some lifestyle modifications like exercises. She planned to walk 5 kilometers every day with a flat sandals. Now, this is the classic presentation of plantar fasciitis. So, what exactly is plantar fasciitis? Plantar fasciitis, if we break it down, plantar means the bottom of the foot or the sole. Fascia means it is a thin, stretchy, tough band which is the supportive structure. It is surrounding the bones, the muscles, the ligaments to give an extra support. It's like a tissue that runs from the toe towards the heel to give an extra support and act as a shock absorber. So when this fascia is overstretched or overused, there is a chance of having micro tears in it. This is the reason of having the severe pain and stiffness on the bottom of the foot. So this is the most common complaint. The patient will be like, I have severe pain when I get up from the bed in the morning. When the fascia gets overstretched or overused by time, it will have micro tears in it, and over the time this will lead to pain and stiffness. The most common complaint, just like our patient had, it is the sharp heel pain, especially the first few steps in the morning or after prolonged rest. Now let's discuss about the common causes or risk factors of plantar fasciitis. People who are on their feet for a long period, like teachers, nurses, factory workers, policemen, those who walk or run long distances, especially on a hard, rough surfaces, wearing unsupportive footwear like flats, high heels, will have increased stress on their heel. Another big contributor is our body weight. Even a moderate increase in the weight can put extra load on the plantar fascia. Flat feet or high arches can also play a role. Now, many people wonder, do I need to have any scans or tests to diagnose this? So, see, most of the cases are clinically diagnosed. A doctor can usually diagnose this with clinical examination as well as the history of the patient. Pressing near the heel typically causes severe pain. Patient will jump with pain. So what can you do if you have a plantar fasciitis? The most important thing is obviously the rest. Try to reduce standing or walking on hard floors. Avoid barefoot walking, especially in the morning. Ice packs can help to reduce the acute pain. Try icing your heel about 10 to 15 minutes, especially after activity. You should also avoid high impact exercises. Footwear makes a big difference. Wear shoes with good arch support and cushioning. Orthotic insoles can help too. Orthotic insoles like silicone insoles can help too, especially if you have a genetically flat feet as well as abnormal foot biomechanics. Now, I get asked a lot, what about medications? See, you can take over-the-counter medications like paracetamol, or even your doctor can prescribe you any sort of short course NSAIDs. Very rarely, if the pain continues for several months, we may consider a steroid injections near the heel. But this is done with caution because repeated injections can cause weakening of the fascia. Now, let's come to the most important part, the exercises. Stretching is the key. Most people improve with a combination of plantar fascia specific stretches, Achilles tendon stretches, and strengthening exercises for the foot muscles. Let me take you to a few simple ones that we can do at home. First one, towel stretch. Sit on the floor with your legs stretched out. Loop a towel around the ball of your foot and gently pull it towards your feet, keeping your knee straight. Hold for 30 seconds. Repeat 3 times on each foot, especially in the morning. The second one, half stretch against wall. Stand facing a wall. Place both the hands on the wall and put one foot behind you. Keep that heel on the ground and bend your foot and bend your front knee until you feel a stretch in your back leg. Hold for 30 seconds. Repeat it 3 times. Third one, plantar fascia massage with a ball. Take a tennis ball or a frozen water bottle and roll it under the arch of your foot for 5 to 10 minutes. Do this twice daily. Fourth one, throw curls with a towel. Place a towel flat on the floor and try to scrunch it towards you using just your toes. This helps strengthen the small muscles of your foot. And the fifth one, night splint, which is very optional. Some people benefit from wearing a night splint that keeps the foot in the dorsiflexed position. Basically, stretching the plantar fascia overnight. It's not for everyone, but in very chronic cases, it can help. Now you may be wondering, how long does it take to get better? With proper care, rest, footwear changes, and regular exercises, most people see significant improvement in 6 to 8 weeks. But in some stubborn cases, we may consider physical therapy, shock wave therapy, or rarely some surgical release of the fascia. But this is very uncommon. So in summary, if you have a persistent heel pain, especially which is worsening in the morning or after prolonged rest, it might just be plantar fasciitis. It's treatable. With the right exercises and lifestyle modifications, you can get back on your feet pain-free. If you found this video helpful, please share this with someone who is dealing with plantar fasciitis. So give it a like, share and subscribe to my channel for more such health stories and tips from real patient cases. Thank you for watching. I'll see you in the next one. Bye.